In 1933, the Nazi government passed the Nuremberg Laws for the protection of hereditary health. This legalized involuntary sterilization.
So Hitler found a perfect meshing of his Nazi ideology with the eugenic Nazi medicine or racial hygiene movement.
Germany's sterilization laws led to the involuntary sterilization by doctors of about 400,000 Germans. Nazi doctors sterilized citizens against their will, euthanized 200,000 disabled German children and adults, and created the gas chambers and crematoria that were used for the mass murder of 6 million Jews, Poles, and Gypsies. Without the full support of physicians, scientists, and nurses.
We interrupt this program to bring you an important COVID-19 response update from Governor Tim Walz, already in progress inside the governor's mansion.
We've worked with the professionals who know how to do this. We formed a community resilience and recovery work group with the public-private partnerships. We want to be data-driven, an expert in this, the best practices. We have a set of principles that we're working on, the vision of Minnesota, the administration's 3-phase plan, best practices on social distancing. I've asked you to try and help us getting society to act differently than we ever have, maintaining 6-foot social distancing, avoiding crowded areas, staying close to home. Don't travel all over the state. At some point in time, we will start climbing that curve.
We interrupt this cold, monotone, dispassionate, bureaucratic, junk science mumbo-jumbo rambling diatribe to bring you an interview with a true leader who actually gets something productive done for real, identifiable human beings.
One of the organizations stepping in is the Guardian Angels, with volunteers caring for one of New York City's most vulnerable population, the homeless and those with mental health issues. Here to discuss their efforts is the founder of Guardian Angels himself, Curtis Sliwa. Thank you so much for joining us.
Oh, pleasure.
When most people hear about the Guardian Angels, they think about the volunteer vigilantes reducing crime on city streets and subways, but they also do other philanthropic work. Talk about what your group has done so far in helping the homeless during the coronavirus pandemic.
Well, you know, during normal times, when there's no coronavirus, these people are out of sight, out of mind, the homeless, and especially the emotionally disturbed persons. But now, they're very obvious in the streets and in the subways and in the parks and in every nook, cranny, and corner, because most of the other people have been told to shutter in, stay inside. So we've noticed that government agencies that might normally be tending to their needs have themselves padlocked themselves. They've closed the public bathrooms. They've closed the food kitchens and the soup kitchens. So how are these people supposed to survive? And we know them because we see them during the course of our normal patrols. So then we didn't wait for a government initiative. We didn't wait for government money. We went out there. We're starting to tend to their needs. We're holding them. We're not wearing masks and gloves. We're actually having conversations with them, washing their hands, washing their face with alcohol solutions, giving them nutrition, finding out if they have their medication because many hospitals have been closed to them, and tending to their needs like a good Samaritan, while everyone else has window shades on their eyes and they just want to act as if they don't exist. Well, guess what? Even if you don't like homeless and emotionally disturbed persons and you think it's a blight on society, if they catch the coronavirus, they're not going to go to a doctor. They're not going to go to a hospital. They're not taking their temperature. It will spread like wildfire in their community, and then it will spread to the general community. So for common sense reasons, pragmatic reasons, we must take care of these disenfranchised people.
One of the concerns is how the coronavirus could spread like wildfire, as you mentioned, among the homelessness, especially since there's reports that 1 in every 125 New Yorkers is homeless. What are you urging city officials to do to prevent the coronavirus from spreading among the homeless population?
Well, first off, there are two kinds of homeless. There are those that live in shelters. That's about 60,000 in New York City. I've been in the shelters, and I got to tell you, it's abysmal to begin with. but they're put into beds that are like 2 feet away from one another. They're hacking, they're coughing, they're sneezing. Under normal circumstances, they have to be in by 10 at night and they get kicked out at 9 in the morning. No services provided, no intervention whatsoever. So that's a problem. That's a ticking time bomb. Then you have an additional 10,000 who roam the streets and subways. Those who are emotionally disturbed need to be taken to psychiatric hospitals and given care and given their medication. Then there are the alcoholics. There are the drug addicts. They need rehab. Now, that may not be available right now. And then about another 20%, they're destitute, so they're living in the streets. They need to empower groups like the Guardian Angels to go out there. We don't want their money. We don't want taxpayer money. But give us the green light and the freedom. Stop telling us to shut yourself in, threatening us with arrest, chaining ourselves to a radiator. And you know what? They're letting prisoners out of prisons. They're letting prisoners out of prisons who are coming into the streets to continue to commit crimes. This is crazy.
I hope viewers and subscribers to the Homeless Consultant channel were not under the impression that I'm the only person saying the things I do on this channel, often quite loudly and emphatically, which comes from the passion of sincerity. I should also point out that in the state of Minnesota, there is no chapter for the Guardian Angels. You see, the Guardian Angels do not sit around all day just talking about how nice they are. They demonstrate that love is something you do, not something you feel. And they do so voluntarily, without getting paid. And because of that, the Guardian Angels are true American heroes and true leaders. We now return to our original programming, this time uncensored.
For the mass murder of 6 million Jews, Poles, and Gypsies. Without the full support of physicians, scientists, and nurses, the Holocaust, as it unfolded, could never have happened.